Now, it can't all be genes, right? Because we're getting bigger and bigger and bigger. We're getting more and more obese. So it can't just be our genes. You know, we have to take some blame in this, right? I beat anorexia. There are twin studies that show this genetic correlation, but there's also the interaction with the environment, and we got a terrible environment. And like I showed you earlier, we're eating more and more of everything. And the worst part about it is we are favoring the foods that are most likely to play into this genetic predisposition to obesity. The USDA government recommends a pretty decent plate of, fruits, vegetables, protein, dairy, for what reason? Because the dairy guys pay. But anyway, look, pretty decent plate. But do we put money towards fruits, vegetables? No. The vast majority of our money goes to the protein and dairy. Very little goes to fruit and vegetables. So we don't put our money where our mouth is. And that leads to this. A burger should cost about $12. That's what a burger should cost. But instead it costs 99 cents because of subsidies that go to the food that the cows eat and things like that. Whereas, a salad costs $5. And there's a lot of marketing. Here I am with Ronald McDonald. Oh, this picture was funny. I was about to run the Chicago Marathon, and Ronald McDonald was there. I was like, what is Ronald doing here? And I think he thought I was going to take a picture, like, look, I'm with Ronald. I was like, look at this idiot. But we just have such a weird conception now that Ronald McDonald's at a marathon. It's so pervasive in our, Coca-Cola is like all about exercise now. It just, the way we look at exercise is so weird. Look at these guys taking the escalator. I see people, in the gym. They sit all day, then they go to the gym and they sit on the exercise bike reading a book. And of course, we're all stressed and we're unhappy, and that fits into it a lot. I have an on-staff psychologist for my patients because everybody has got childhood trauma and depression and stress, and this really factors into eating disorders. And it's interesting to me that there are disparities just in zip codes. Like you could look at a zip code and know what the weight of that zip code is likely to be. Zip codes vary based on, is it a food desert? How many parks are there? How many fast food restaurants? So there is a huge environmental factor to this. So let's go back to Marcus. Marcus comes to my office. What am I going to tell him now that I know all this? Am I going to tell him eat less, move more? That's what everybody tells people. Eat less, move more. I want him to eat less and I want him to move more, but that is not a prescription. All right, that doesn't work, telling people to eat less, move more. If you guys remember The Biggest Loser? I took these people, they told them to eat a lot less and move a lot more. What's interesting is they lost a lot of weight, oppressive amount of weight, but they put it all back on. And Johns Hopkins studied them. And what's interesting to me in the study is that while they lost a lot of weight, they put it back on, but they kept exercising. So 6 years later, they're still exercising almost as much as they did on The Biggest Loser. But look at their metabolic rate. Their metabolic rate has dropped considerably since before The Biggest Loser. They were burning about 2,600 calories. After The Biggest Loser, 1,900 calories. 6 years later, 1,900 calories. That never got better. So their metabolic rate has changed dramatically. And this idea that exercise is going to cure obesity, it's good for helping maintain. But they did a good study where they looked at Americans versus the HASDA. The HASDA are very healthy and lean, and they're eating a predominantly plant-based gathered diet with some hunted food. And they walk a lot, but they don't walk that much more than us. In fact, when you look at the blue zones, they don't walk that much more than us. Physical activity is certainly good for your health, without a doubt, but it's not a great weight loss mechanism. And why is that? People burn 700 calories, and they're like, okay, that deserves a margarita. And then that's the end of it. And the other thing is people do a really bad job. I have done everything to help people lose weight. If there is something out there, I've done it. And I used to have the most sophisticated office you've ever seen. People would come in and they'd have to blow into a machine so I could measure their metabolic rate. I'd have them sit in what's called a bod pod so I could get exact measurements. I would have them detail everything they ate. And the more I tried to say, I want you eating 1,323.1 calories, like I had the scientific formula. And the more scientific I tried to get about it, the worse they did. And there's many reasons for that. People don't know how to count calories very well. There's a lot of things they miss. There's a lot of things those apps miss. And you can see in this study, I mean, people were underreporting calories like crazy. And there's many reasons for that. I mean, look at Pam cooking spray. Pam cooking spray. How many calories in Pam cooking spray? 0. How much fat? 0. No fat, no calories in Pam cooking spray. How is that possible? It's all fat. Look at the, right, exactly. Look at the serving size. 1/4 of a second of a spray. That's the serving size. That's how they could tell you it's 0 calories. So patients are like, oh, 0 calories. Oh, you know? And then they go on like, Weight Watchers. And Weight Watchers is amazing to me because it's just like, you get this like, I'm going to eat 10 points right now. Then I'll skip lunch. I'll eat 12 points later so that I can save 5 points. That body doesn't work like that, It's not going to work. Weight Watchers and Atkins are the most commonly performed diets before that people get weight loss surgery. They've been done a gazillion times. I think we really got to think outside the box a little bit here. We got to look at food differently for sure. What comes with a steak? Cancer, heart disease, and your choice of rice pilaf. We have to look at, what our number one recommendation is when it comes to food and eat more protein. Everyone thinks protein's for weight loss. Well, some people think I'm going to eat protein to gain weight. Protein shakes are sold as weight gainers and as weight losers, which is weird. But we eat more protein, especially more animal protein than any other country in the world. How's it working for us? We're the most overweight country in the world. We spend the most money on disease processes, on healthcare. Definitely leave the world in weight. And what's interesting to me, the EPIC data study, which is probably the biggest study ever on epidemiologic study on long-term health and diet, showed that the number one food associated with weight gain over time was actually meat, specifically chicken, which is the food that my patients swear is what helps them lose weight. You got to understand, when I see a patient and I look at their food log, why are you gaining weight? Because I had a Snickers bar yesterday. Okay, but you had eggs and bacon for breakfast, chicken for lunch, and chicken for dinner. Yeah, that's healthy, right? It's the Snickers bar that did it. They don't add they figure that the calories from the chicken and the eggs are fine, but they obviously aren't. And if you look at the healthiest populations in the world, if you look at the blue zones, they're eating a predominantly plant-based diet that's actually very low in protein. And if you look at the EPIC data study, the vegans have the lowest weight. And you look at the Adventist Health study, the vegans are the only people with a normal BMI, a normal body mass index. And what are they doing? They're eating a predominantly plant-based, high carbohydrate, low protein diet, very similar, though lower fat, than the Mediterranean diet. No matter what you look at, if you eat a higher protein diet, especially animal protein, because animal protein's higher in leucine. There I went. I got into protein. I was not going to get into protein, but we'll get into it shortly. Animal protein is high in leucine. Leucine stimulates IGF-1. IGF-1 is a growth factor, all right? It's going to make you grow. And so that is a factor. And of course, animal protein changes your gut biome. I often wondered, what if we took a whole bunch of vegans and we made vegan stool pellets and gave it to people? Maybe that would help them lose weight. I don't know if they would take it, served daily. But there's definitely changes in the microbiome of vegans. Now, is it the microbiome that's making people lose weight, or is it the fact that they're vegan that changes their microbiome? What came first, the chicken or the egg? There's some evidence that if you eat a plant-based diet, you increase the kind of bacteria that produce short-chain fatty acids called butyrate. And if you have butyrate, that does help with satiety factors. And so that's interesting. Certainly, eating a plant-based diet, there are many factors in a gastric bypass that lower some of the hormones that create hunger. And the same thing does happen with a plant-based diet, just to a lesser degree. Of course, Brenda talked today about calorie density. I won't spend a lot of time on it, but it's really important. We got to look at calorie density. Calorie counting doesn't work. Calorie density works pretty well. Instead of telling my patients, I want you to eat this many calories, I tell them, you could eat as much of this as you want. One of my patients said, no way. You're lying. I was like, I don't care how many apples. She goes, okay, I'm going to eat as many apples as I can to prove you wrong. And one day she ate 6 apples. And when she came to me a month later, she'd actually lost weight. She's like, damn it. You're right. I could eat as many apples as I want. And then I tell them, watch it here and really watch it over here. I mean, I don't mind if you have some nuts, but, watch it. This is very high calorie density. And a lot of this has to do with fiber. The lower calorie density foods have higher fiber, and as Dr. Willett showed, higher fiber is going to help with satiety. If you look at this study where they had people eat different foods and measure their satiety, what is the most satiating food a human being can eat? Potatoes. The most satiating food, which is why I get angry when people say bad things about my lovely potatoes. There is an excellent study done by this lady named Barbara Rolls, and she took people and she said, look, all that matters is this calorie density. If we could fill, because there's a nerve in your stomach called the vagus nerve, and if it gets a stretch receptor to it, if it feels stretched, it tells the brain, okay, we got food in there, we're all right. So she looked at this and she said, I'm going to give people the same amount of food, but one food's going to have 85% the calories of the other, and one's going to have 75% of the calories. So the energy intake from each is going to be less. The same volume of food, just less calories for each one. And guess what? People lost more weight on less calories, obviously, but they didn't feel any different. They felt like they were getting the same bowl of soup as the person with 100% calorie in it. And how did she do it? She just added more vegetables. She added more fiber. The more fiber she added, the lower the energy density. And that worked. And her book's excellent, The Volumetrics Weight Control Plan. This is spread. Now there's things called like the DASH diet. I don't know if you guys have heard about the DASH diet. It always gets the most press. It was started by some of Dr. Willett's partners. They actually had studied the effects of a vegetarian diet and found that a vegetarian diet worked fantastic, but they didn't feel they could tell people to go vegetarian because they wouldn't do it. Also, they created the DASH diet, which is fairly balanced, lots of fruits, vegetables, and grains, but it still has some meat and dairy.